Thank you for joining our webinar today. First, wanted to introduce ourselves. My name is Matt Peterson. I'm a relationship director with MapleLMS. I work closely with our associations and nonprofit clients. At MapleLMS, we partner with them on training, continuing education, and professional development programs, and to really help them achieve their objectives around those education programs. Joining me today is my colleague, Avin. Avin, nice to have you with us.
Thank you, Matt. Nice to be here.
Great. Just a couple of housekeeping items before we get started. We do want to encourage you to ask questions throughout the queue. You can use the Q&A feature at the bottom of the screen, and we'll be happy to answer them live or in the chat or at the end of the presentation. So today's topic is how to unlock LMS potential for healthcare continuing education. At MapleLMS, we support many professional healthcare associations by providing them with the solutions to create, organize, manage, deliver, track, and sell CME credits to their physicians and healthcare workers. Currently, there are thousands of healthcare workers earning CME, CNE, CPE, and much more in our platform each month. So now we'll move along to the main points that we'll be covering over this webinar. And today's presentation is also going to include a live demo. So some key steps when we talk about creating any continuing education for healthcare workers in an LMS. You first need to really understand the criteria for your accrediting body. So throughout much of this presentation, we're going to use ACCME, the Accreditation Council for Continuing Medical Education, as an example, and focus on kind of what their criteria is for a CME course creation. You really need to understand what the requirements are of that accrediting body. And depending on the healthcare workers that you're providing education for, your accrediting body may be different. For example, in the case of nursing education, that would be ANCC, or American Nurses Credentialing Center, for CNE credits, but there's many more. Over the years, the focus has really been transitioning to quality over quantity for CEUs, and really focusing on learning outcomes to support improving professional practice and for the ultimate goal of improving patient outcomes. So using an LMS to create healthcare CE, LMS can be really used for in-person, live, virtual, and on-demand CME courses. And today we'll walk you through how to build a course with the key components to meet the criteria for quality medical education. We'll also be focusing on options for delivering your educational experiences, and we'll also include the process of selling CME or CE credits. Next, we'll cover how to track them. And LMS provide great analytics and data to track your CE, but also to evaluate courses and to also ensure you're meeting your objectives that you set forth. And then finally, we'll be covering maintenance of certification and recertification for healthcare. So we can move along to the next slide. So as we talked about, ACCME really sets standards and guidelines for accreditation and CME activities in the US. And when approving a CME course delivered through a learning management system, ACCME typically looks for several key criteria to ensure that the course meets their accreditation requirements. As mentioned, depending on your governing body, these requirements may change slightly, but you will find many similarities. But it's important that you follow the guidelines for your particular body. First is relevance to healthcare professionals. So ACCME really expects CME courses to address the educational needs and professional practice gaps of healthcare professionals, such as physicians, nurses, and other healthcare providers. The content should be clinically relevant, evidence-based, and aligned with the target audience's scope of practice. Secondly, you always want to have learning objectives. So ACCME requires you to have clear and measurable learning objectives that specify the knowledge, skills, or behaviors participants will acquire upon completion of the course. The objectives should be achievable within the context of the course format and duration. And usually you want to put these right in the course overview. Third is interactivity and engagement. So as mentioned, an LMS can be used to deliver live or live virtual training, which provides a lot of interactivity and engagement in CME activities. But you can also provide this interactivity and engagement for on-demand CME courses as well. So a course delivered through an LMS should incorporate interactive elements such as quizzes, case studies, simulations, discussions, and self-assessment exercises to enhance participant engagement and promote active learning for on-demand courses or provide similar elements for live virtual or hybrid courses. ACCME also requires CME courses to include an accreditation statement that identifies the accrediting bodies, such as ACCME, the type of credit offered, such as AMA PRA Category 1 credit, which is American Medical Association's Physicians Recognition Award, and most commonly accepted for of CME accreditation statements should be prominently displayed within your course materials. Fifth, we have faculty credentials. So ACCME CME courses to be developed and delivered should be delivered by qualified faculty members with expertise in the subject matter. Course organizers should provide information about the faculty members' credentials, affiliations, and relevant experience to demonstrate their expertise and credibility. And faculty need to provide any financial disclosures. So MapleLMS tools allow you to feature your faculty or instructors and their bio, as well as any financial disclosures as necessary. Six would be the assessment and evaluation component. This is really to measure the participants' learning outcomes and the effectiveness of the educational activity. Courses delivered through an LMS can easily incorporate quizzes, exams, knowledge checks, and also surveys or other assessment methods to assess participants' knowledge and skills. ACCME also encourages CME providers to demonstrate the impact of their educational activities on healthcare professionals' performance, patient outcomes, and population health. So course organizers should collect data on participants' behavior change, their practice improvement, and patient outcomes whenever feasible. So an LMS has tools to collect and aggregate this data from your learners. Next, we have compliance with accreditation criteria. So ACCME will expect CME providers to adhere to the accreditation criteria and the policies outlined in the ACCME standards for commercial support and other relevant accreditation guidelines. Course organizers should ensure compliance with these standards to maintain the accreditation status. And then finally, we have documentation and reporting. ACCME will require CME providers to maintain documentation of the planning, implementation, and evaluation of CME activities, including participant attendance records, evaluations, and outcome data. And course organizers should maintain accurate records and submit reports to ACCME as required for accreditation purposes. An LMS will also help you with this task. We can often create a custom report that is appropriate to send to your accrediting body. Or sometimes we can also offer an integration that will automate that process to report the appropriate information to your accrediting body. So by meeting these criteria, CME courses delivered through an LMS can obtain ACCME approval and provide healthcare professionals with high-quality education experience that contribute to their professional development and patient care. So we'll move right along. Can we move to the next slide? Okay, so here we're going to talk about the course creation process. So kind of one of the first steps in creating a course is determining the course structure. So many LMSs, including MapleLMS, will provide you with predefined templates to use to format your courses. So some can be topic-based or module-based. They can include assessments, video tutorials, or you could simply have a single activity course, which may be a webinar or one seminar session. We talked about making the content engaging. So you'd like to have an LMS that will create these interactive components using an inbuilt authoring tool. So MapleLMS authoring tool is called iLearn, and it's a key feature in MapleLMS. It has 45 different interactive formats to create that necessary engagement, particularly for an on-demand course. Next, you'll want to set up any necessary assessments and feedbacks within the template. So setting up relevant activities, assessments in the course template in the form of a quiz, assignment, survey. You may have videos, PDFs, and oftentimes you may want to set a date and time expiry within the LMS to make sure that your content remains relevant. You can also set up gamification. Gamification is another great feature to keep your learners engaged and motivated to continue learning. So there's options to set points, various badges. You can also have leaderboards for learners and reward them with achieving learning milestones within the LMS. You will also probably want to set up prerequisites. So you can set up the criteria against each activity participation or also set up requirements for the completion of the course. For example, you may need to make sure that a learner scores an 80% or above on a quiz, and then maybe complete a survey. And once the survey is completed, then they can take part in the next course, achieve their CME credits, or achieve their certificate. Next, you'll want to set up credit and its types. So MapleLMS supports unlimited credit types, which we do during the implementation phase. So depending on the credit type you would be delivering, our team would set up those appropriate credits, whether it be CEUs, CMEs, CNEs, contact hours, or much more. And the LMS will then automatically assign that credit once the course has been completed and met all the criteria. The next step would be to set up a certificate. So we can create branded certificates within the LMS, and we can customize those certificates to reflect the theme and the principles of your brand. Custom designed certificates provide learners with a feeling of community, which they can showcase to prospective employers, universities, professional networks, and personal branding. And we allow individuals to share their certificates across social media sites like LinkedIn. And then automate administrative tasks. So that's a whole key with an on-demand course. When the course is self-paced without any human interaction, you can have activities, restrictions, any time constraints, and it automates that whole process of learning for users within the LMS, and thus automates the administrative tasks. And then you always want to keep the door open for recertification or maintenance of certification. So medical professionals may need to retake assessments or entire courses for their certificate renewal, earn additional credits, and they can always access the same course again in the LMS. Next, we'll move on to talk about the delivery of courses. So delivery of courses can be, you can launch with a single course, or it could be a bundle of courses. So you could create a course package. So you can launch these various courses in the various formats, and you can have them one course at a time, or you can bundle them, which contains many courses linked together, usually based on their topic or relevancy, or as a per a learner's preference. We also support the idea of setting up a learning path. So a learning path is somewhat similar to a course bundle, but usually it's a progressive path. So you define the learning path for the learners, And then based on completing course A, they may get access to course B, thereby achieving the learning objectives and providing a very sequenced experience for your learners. Learners can also receive tailored recommendations for courses, exams, and additional learning activities with the help of AI suggested learning paths. Many LMSs will also support a competency-based education, and I know ACME really loves to see this. To establish a competency-based learning, competency-based courses for medical professionals, you'll have to first define the competencies and the required levels for each role. So our system will allow you to create a metrics within the LMS mapping to these competencies. You can assign them to learners and you can assess their performance through the LMS. You can provide feedback and identify knowledge gaps for targeted training and support utilizing the data from the LMS. Finally, you can configure your course enrollment with payments set up. So the idea would be that once an individual purchased a course or a learning path or a bundle of courses, they will be automatically enrolled in that course and launched directly into it after payment has been made. So now I'm going to turn it over to my colleague Avin. He'll be discussing tracking, maintaining of certification, and he's also going to lead us through a live demo of how to use an LMS to perform the steps we are discussing today.
Right. Thank you so much, Matt. And tracking continuing medical education, so CME, using a learning management system, really involves monitoring participants, their completion of CME activities, documenting their participation, and also recording CME credits that they've earned. And here's how you can track CME using an LMS effectively. Few items that we see on the screen really indicate towards that. But let's start with participant interest and time spent. This is certainly one thing to track. And MapleLMS does provide you tools to track participant interest and time spent, but many LMS would. Why this is important? Tracking user behavior, like which courses participants are demanding, and also what activities participants are most likely to take part into. We get insights. So we get insights on this information. We get to know our participants, their engagement, and based on those insights, that also allows us to improve our educational offering. So draw more participant interest. Well, to draw more interest, you need to track that, and your LMS or a learning management system typically would tell you what your engagement looks like or what your participant engagement looks like. So that's a key area to track, I would say. And also how much time they're spending in various activities to see their engagement levels in different courses would be important. And then participant registration. Now, this really requires participants to register for CME courses through the LMS, and your LMS should have a way to track that. Many LMS does. So registrations is a key to track, I would say. So if you're looking at tracking and monitoring CE, yeah, you want to keep a track of your registrations, you want to keep a track of your participations, and on top of that, you want to keep a track of how much time these users are spending on different educational offerings, different content files, and that kind of data. Now, also there's some recommendation engine that comes into play. Now, you might think about how that would work. So there are LMSs, and MapleLMS also has a recommendation engine that allows participants to receive recommendations. So assuming I'm taking a CME course, I could be recommended with a few more courses based on a few criteria, few triggers, some data that's already residing into the system. And LMSs, including there are different LMSs with different type of recommendation engines and different ways that provide recommendations. For instance, in MapleLMS, there are tools to provide recommendations through simple tagging of courses, or even by identifying interest of an individual a user, and they get recommendations according to that. And on top of that, There are tools like competency-based education. There are tools like learning plans that also allow you to provide recommendations. So there are various ways. And what's important about that in terms of tracking is to see how your users are getting recommended, like what recommendations are they getting, and if they're really engaging into those recommendations, and if that needs a change. So that's something to track as well. Then it comes to then we go to monitoring certificate expiration. Now, this in a nutshell is a way to monitor all the certifications that have expired, or basically look at users whose certifications are about to expire. So an LMS that provides you tools to track and monitor expiration of certificates and certifications would be a key tracking tool uh, and a must have, I would say. And then if the certificate of the participant is expiring, the LMS system will suggest them to regenerate it by going through courses, assessments again, and will also notify them about it before expiration date. So those are also some tools that come along, and tracking that certificate expiration would be one part of tracking and monitoring the CE. And then tracking your credit allocation and usages. Credit allocation and usages. Now, when we configure the LMS to allocate CME credits to participants, there are many things that come along. There are many configurations that can be utilized. For instance, we can allocate or issue credits when somebody completes a course, or even if they simply take a live class or a webinar that's scheduled inside a particular training. Now, how do you keep track of all of those credit allocations and usages? So there are dashboards, there are different types of reports that can be enabled to track and monitor these things or credit allocations. And in most cases, if you're let's say if your LMS is also integrated, and particularly if I speak about MapleLMS, let's say if your MapleLMS instance gets integrated with your AMS, um, you'll also see that data in your AMS and will be able to track that. But again, coming back to tracking and monitoring CE, that's the key point that we're looking at right now. So credit allocation and usage tracking, I would say, would be a key to track. And then audit trail. Audit trail is really about maintaining an audit trail of participants and their CME activities and credit transactions within the LMS. And the key here is to track changes to participants' records, credit allocations, and accreditations status to ensure data integrity and compliance with accreditation standards are maintained. And then compliance monitoring. Compliance monitoring is really about regularly monitoring participant compliance with CME requirements and accreditation standards using the LMS's tracking and reporting capabilities. Also identifying any discrepancies or non-compliance issues, and take corrective actions as necessary to maintain accreditation status. And this also includes external reporting, in which certifications credits are sent to external systems like PARS or board of BPS, as they call it, and different systems. And then lastly, in terms of tracking and monitoring CE, I would say learning outcome clearly is something to consider. So learning outcomes are the quantifiable knowledge, skills, and values that learners are able to exhibit after finishing a course. And LMS tracks if the learner is now capable of or skilled in that particular course, or even a particular skill or a competency. And by leveraging the tracking features of an LMS, you can effectively monitor participants' completion of CMEs, document their participation, ensure compliance within accreditation requirements are maintained, and most importantly, provide a streamlined and transparent process for managing the CME credits and also tracking. Now, from here, let me move on to the next item, which really refers to recertification and also maintaining certification of healthcare professionals. Now, maintaining certification of healthcare professionals through a learning management system involves tracking their continuing education activities, and also the items that we previously looked at, tracking, delivering, managing all this through the LMS. And when it comes to recertification, there are quite a few things involved. And here's how you can use an LMS to maintain certification for healthcare professionals effectively, starting with centralized record keeping. Um, we can actually use the LMS to maintain centralized records of healthcare professionals, their certification status, and including any expiration dates, renewal dates, any renewal requirements, and continuing education credits that they've earned. And with centralized record keeping, we just ensure that the LMS can store store and retrieve this information securely over a period of time. And also continuing education tracking. Now, implementing tracking mechanisms within the LMS to monitor healthcare professionals, their completion of continuing education activities, which are required for certification renewal, and also tracking participation in accredited courses, workshops, conferences, and other educational activities. And then if you look at the next point, accreditation compliance, now this is about ensuring that the continuing education activities offered through the LMS comply with the accreditation standards, which we briefly talked about previously, and also the requirements for certification renewal. And from there, if you look at automated reminders and notifications, so how these come into play. So basically, enabling healthcare professionals to receive notifications or reminders through the LMS is basically the functionality behind that. So LMS would come with automated reminders and notifications, and you'll have the abilities to set up automated reminders, notifications within the LMS to alert the healthcare professionals of upcoming certification renewals, deadlines, any expiring credits and outstanding requirements, and also keep them informed about the status of their certification and any other actions needed for renewal. And then credit documentation and reporting. So this is really about enabling healthcare professionals to document their participation in continuing education activities within the LMS, and providing options for uploading certificates of completion, transcripts, or other documentations to verify the continuing education credits. Um, and then from there, credit validation and verification. So this is really about implementing validation and verification processes within the LMS to ensure the authenticity and validity of continuing education credits submitted by the professional. Um, right, and then reviewing documentation and confirming compliance with certification renewal requirements would be something to consider. Audit trails and compliance reporting, we talked about that. Maintaining an audit trail of healthcare professional certification renewal activities and credit transactions within the LMS, and also generating compliance reports to demonstrate adherence to certification requirements and accreditation standards. Now, self-service tools, how these connect with recertification. So that's also something to explore. Self-service tools like within the LMS, such as tracking the certification status, viewing the continuing education records, and monitoring progress towards renewal, are basically some tools and some core features behind that. So there should be some self-service tools, I would say, within your LMS that really empower your users, your learners, your healthcare professionals, so they can keep a track of their engagement, the renewals, recertification by themselves, ensure that they get notifications real time, and then professional development resources. Now, this is really about offering a range of professional development resources and accredited courses within the LMS to support healthcare professionals in meeting their certification renewal, and curating content that aligns with their specialties and professional interests. So maybe building courses very specific to that audience. And lastly, providing some support and assistance, and offering responsive support and assistance to healthcare professionals using the LMS for this entire recertification is also a key. In most cases, I mean, healthcare professionals might just miss out on their renewal. So it's essential to have a process in place, the right process, the right tools, the right system in place that empowers you with everything you need and an accurate process to manage your recertification and maintenance of credits, not just on the management side, but also on the end user side. Now from there, excuse me, um, let's move on to the next slide, which really talks about a few benefits that MapleLMS comes with for healthcare CE programs and for organizations who really run healthcare CE programs and provide continuing medical education. Firstly, competency-based learning, that's definitely one of the key features to have or a key solution to have. And MapleLMS is enabled with competency-based education. So you have tools to create competencies, learning plans, and also you can empower your end users or healthcare professionals to self-create a learning plan by themselves. Multi-LMS, that's one of our core features. Multi-LMS or a microsite capability, we refer that as a microsite, or let's just say an independent learning portal for a separate audience. Multi-LMS would also be one of the core features, I would say, that would empower. Now, how? Because there are different types of member organizations. There are different types of organizations who have member organizations, sub-organizations, and what these microsites will allow you to do is to create separate portals, separate instances for specific audiences, groups of users, professionals. They all come to this place, a specific portal in your LMS, take education, which is curated and very specific to that audience. And then you have tools to track their engagement, particularly within that portal. Recertification, we extensively talked about this in the previous slide. And course bundling is one of our core features. It allows you to bundle multiple courses together, create learning paths, or simply packages, sometimes even series of courses. And predefined templates. So MapleLMS comes with some predefined templates that are enabled. So maybe templates for creating learning paths, creating packages, or let's just say a live in-person training or virtual training sessions. So some predefined templates that help you get started quickly. Gamification. Now we have been implementing gamification on and on. And there are always some new gamification tools that come along in MapleLMS. For instance, a leaderboard concept where participants gain points for performing certain activities inside a course. So maybe watching a video or taking a test awards me 50 points, and if I get 100 points, I reach level 2. Gamification so works that way. And also ways to offer badges and certificates would be part of gamification. And then inbuilt authoring tools. Now this is really excellent. So MapleLMS just comes with built-in authoring tools. And these tools basically allow you to create interactive and engaging content. So if you're working with a plain video, let's say an MP4 file, it does not have an interaction. But then with the tools you have in the LMS, you're able to add interactivity, knowledge checks, different types of interactivity, true false question type or a single select question type, maybe some statements or URLs as an interaction. So basic ways to grab attention of your viewer or user while they're watching a video, and asking a user for a response or a knowledge check. So things like that. And also recommendation engine, we touched upon that a little bit. So LMS is enabled with the recommendation engine that supports recommendation in a variety of ways. So maybe based on an individual's interest or a direct recommendation from an instructor to a group of users. And multiple credit support system, that's must have, and MapleLMS is enabled with a functionality where you can self-create your credit type and allocate a credit value. Now, there are so many ways to issue credits, and I believe we'll touch upon some of that as we move into this webinar today. And then inbuilt support system is one of our core features. Inbuilt support system allows you to manage your end user support. So if there's a professional who's looking to get some assistance from the staff, from the organization about the renewal or recertification, or in general, any assistance, they're able to reach out to you directly through the LMS while being engaged into some form of learning. And with that, I'll just move on into a short demonstration of some of these tools that we just discussed. So let me pull up a different screen over here. And I'll dive into MapleLMS, show you some examples. And Matt, just confirm if you can see the other screen. You can.
Yeah,
Okay.
we can see it. Excited to see it.
All right. So right now I'm logged into MapleLMS as an administrator, so I can actually show you all those core tools and features that come along that the users don't see, that the learners don't see. So we have a robust uh, admin view. You have quite a few analytics on top. Let's start with a few examples of different educational offerings that you can build using the tools we have. So here, firstly, you have ways to structure catalog. So maybe your CME courses reside in a different catalog or a different category, or your certification courses reside in a different category. We have ways to set that up. Then as we scroll down, we are looking at a few examples of different course types and different educational offerings. Let me just adjust my screen a bit and show you a few examples. So let's say we look at this course, and that's on the top. Yeah, so it's a fairly simple example of a online course, including quite a few things and quite a few criterias, which you actually discussed when we got started with this presentation today. So including clear objectives, credit designations, these could be achieved in many different ways. For example, a fairly simple example of objectives, disclosure of interest, faculty, educational objectives that are required, and then some information about credit designation. So credit provider and different type of credits that are available. And also then if we go back, we talked about including assessments within your courses and trainings. So you have tools to create a pre-test or a pre-assessment, post-assessment as well, or it could be a clearly a certification exam. We also talked about including restrictions, so maybe having prerequisites and conditions to unlock certain items. For instance, over here, these two activities, so the post-assessment and this presentation is restricted based on a criteria. It's not available unless the pre-assessment is checked as completed. So things like that, and maybe including a feedback survey to evaluate and get some feedback from your participants. And then clearly we talked about gamification, so including certificates and credits inside your courses. For instance, this example here is a certificate, and you have quite a few tools to manage the certificate. Firstly, we can look at all the certificates that were achieved. So we have a view of users who earned a certificate, a unique code that comes along with the certificate and also indicates if it's expired. Then you have a way to export this certificate as well. And then there's certificate setup, which allows us to add or include a few more items. So we can include course credits, different credit type. Let's say we want to include AMA, PRA, and CME, and then we can pick any other credits as well. So various ways to manage certificates, credits inside your courses, and also I would indicate different ways to issue credits from the LMS. So we support an automatic way where a learner can simply complete a course, earn a certificate, and the credit value will be automatically printed on the certificate with the credit type. And that too, if your course offers multiple credit types. But the second way could be where your learners can manually claim a credit type or a credit value. So for instance, this course offers AMA PRA 1 and one AAP ACCME. And we can provide options. So we can provide options to claim one, or we can provide options to claim multiple credit types. But then on top of that, both your learners as well as administrators will have a view of all the achieved credits. So we can very well track credit allocations. And I'll also show you a few more examples of these, like what an end user would see, how they would see this in their transcript. But right now we're looking at it from within a course. So we can first filter and look at a particular credit type. So I just picked up API category CME. And in this case, it shows me all the users who've earned this particular credit type, the credit value, the date when it was earned, if it was issued, if it's expired, and if it was automatically awarded. And then you have filters around date ranges, so we can filter by a date range as well, or filter by a course type and look at the credits for a specific course. So some tools around that. And then we talked about interactivities, so that's definitely a must-have. Here's a quick example of a Now, this would be an example of an interactive video containing a few knowledge checks. And this is exactly something that I described a few minutes back. So while a learner's watching a video, we can have some engagement, some additional engagement on top of this video. So we get some feedback, and also we ensure that the learners are not just passively watching the video, but actively engaging into the content. So for instance, in this video, let's say we reach this timestamp where I have a interaction added, and timestamps could be multiple. So we can have one or multiple interactions at different levels at different timestamps. And whenever these interactions trigger, for instance, right now, the video pause, I click on the interaction, and then it's asking me a question about the video that I'm watching. So those are ways to layer interactivity. And then on top of that, if you particularly work with content files such as SCORM, then those could be easily added or uploaded within a course in MapleLMS. Also, if we go back to some of our settings within this course, you have ways to manage the course in many different ways. You also have options to include summaries. So we talked about summaries and including disclosures. These could be added at many different levels. We looked at the same example, but now let's say if we want to see what a learner would see or how a learner would see this information, then we can actually go to this page. So now this is how your end users will see a description, educational objectives, faculty disclosures, and any credit information, credit requirements, computer system requirements, disclaimers, all within the same page as for informational purpose. With that, let me also move on to a few more items which are around recommendation, and we looked at multiple credit system, but also recertification process. So let's talk about that as well. So let's say I have this learning path, and this would also be a great example of a learning path. So it's a learning path built out of the package format that we have, and this package contains 5 individual courses. All of these courses can offer different types of modules, different types of lessons, and might even include certificates individually and have options to claim credits individually. From a administrator's perspective, you're able to track engagement of your package from here. So this report will show you a list of participants that are enrolled and their progress within each of these individual modules or individual courses, and then the aggregate right over here. From here, I mean, those are just some tracking capabilities. We already looked at a CE report, but then inside a course as well, we have ways to track different reports, look at logs and different activities, and so many different solutions that come along for CME, including integrations with web conferencing platform to run live classes and webinars from within the LMS, or even set up in-person training events. And then on top of that, we talked about multi-LMS capabilities. So here's an example of a portal. So here I have multiple learning portals into my system. These are all just for demonstration purpose. But then here, a quick example of how the theme changes, how not the theme, but how the branding changes as we switch to a different site. And that way you have options to create multiple portals within your MapleLMS environment. Also, in terms of reporting, there are so many robust reports to manage, but we looked at a very specific report, CE. What I wanted to point out is the ability to build custom reports. So maybe tracking data that's very specific. And particularly if you run a cohort program. So if you offer a cohort-based learning, this is a tool for you. You can filter and create reports for different types of cohorts that you have, and different ways to create custom reports. So those are just some capabilities. We looked at bundling, some recertification options, multi-LMS capabilities. Now, let me take you to some competency-based education as well. So over here in this profile, and this is the profile of a user. Every user gets a profile. And here are the interests that I indicated. So these interests also allow the LMS to give me recommendations, such as, I'll show an example in a bit. But then here you have achievements, all your achievements, badges, and certificates right over here, as well as the credits that you have earned. And right over here, you also have data around your live classes. But then going back to competency-based education model, so here you have options to create learning plans as an end user. Any user, any learner can, or let's just take a real-time example. A medical professional can come into the LMS, self-create a learning plan by adding a learning plan for themselves. Let's say I was creating a learning plan for myself, and then it will allow me to pick a few competencies that I'm interested in and find courses relevant to those competencies. So if I call it new learning plan, say 2024, and let's keep it draft, let's save it. We can actually set a due date. So you can set a due date by yourself. So the system also reminds you when you reach that deadline that you need to reach your goals and complete your competencies, complete your learning plan. But now that we have this learning plan, we can add competencies. So I can pick from different frameworks that are available. And with that, it does allow you to build competency framework and these individual competencies and simply add that to my learning plan. Now, by default, I'm not proficient with these competencies because I've just added and I haven't received a rating for this because we haven't engaged into any competency-based course. But then we can find courses from here, and that will list down all the courses that I need to take. And again, these are just for demonstration purpose. But then here, those linked courses could be recommended. And the user, once participates in those courses, completes those courses, they can get a proficiency rating as proficient or not proficient. And on top of that, you can rate them as competent or not competent with a particular skill. One example might also be to create a competency-based assessment. So learner comes in, takes an assessment which is specific to a competency. And based on the score, the system identifies whether the learner is competent or not with that competency. So those are some tools that we looked at. And with that, Matt, I'll redirect back to you. Give me 1 second. I believe you have a few conclusions. So let's go to that.
I do, and I thought David had a question about variable credit awards and also about faculty management. So I did answer that in the Q&A, but just wanted to mention the credit award system is variable. So you can award credits based on each individual activity into a course, or you could also award credits for completing the overall course. And our system also allows the awarding or the claiming of partial credit. And then David also asked about faculty management tools. So we have a role in MapleLMS, which is known as an instructor. That'll allow you to easily add instructors to a course. That'll give them some functionality, as many permissions as you want to give them to manage the course and the participants. But then they can also be featured with their bio, their disclosures. And if you so desire, you can allow participants to message their instructor, or you can create social forums for discussion around courses, often led by the faculty member to offer additional resources or offer additional support in the course. So just wanted to hit upon that. I didn't see any other questions at this time, but if you do have any questions, feel free to post those in the Q&A. But just in conclusion, just wanted to hit upon our main points. We talked about how you need to be familiar with your accrediting body's objectives for delivering CME and how CME course creation can happen in an LMS and all the different elements that you can add to those. How you deliver your course and the different options for formatting that course. And also, you want to think about how you want to monetize or charge for the course, or maybe it's included in membership, or maybe some courses are free, or you have premium courses. We also talked at great length about all the tracking tools and audit trails that are available to make sure you're monitoring all the progress of your learners. And then we also concluded with how to maintain certification for healthcare professionals or recertification and the requirements around that. So in conclusion, a learning management system really optimizes medical continuing education, offering multiple credit systems while efficiently tracking the progress and issuing certificates and those credits. It also seamlessly allows you to track those credits across the system. It can tailor learning paths to individual roles and competencies. And additionally, it provides real-time monitoring and personalized feedback, enhancing engagement and competency assessments with the interactive tools embedded within the LMS. Next, we just want to offer a couple QR codes if you'd like to read more about. We help many healthcare associations, and we have a couple links to a couple case studies here of particular healthcare associations and professionals that we've helped with their education programs and how MapleLMS really transformed that education process. So we appreciate you attending and your interest in the topic of using an LMS to deliver continuing education for healthcare. We hope the information presented today was helpful and will support your CE program for your healthcare workers. The webinar will be posted on our website for future on-demand viewing within a couple of days. And if you'd like to continue our conversation or ask any additional questions, you can feel free to reach out to the email below, sales@maplelms.com. There's also a link to our website. We'd love to have you check out all the additional offerings. We have some information specifically about healthcare associations on our website. So thank you for joining our webinar today. We hope you enjoyed it and have a great day.